We get to look at another type of amputation. So this type of amputation is what is known as an ankle disarticulation. So ankle disarticulation, they also call it the Syme's amputation. So you can see just by the picture, just by seeing the picture, you get to understand fully what I'm actually talking about. So look at the ankle. So right into where your leg is meeting the foot. Okay, they basically take you from that level. Okay, they take you from that level, you know. So ankle disarticulation is also known as Syme's amputation. It's a surgical removal of the foot, and this is through the ankle. And you do this, you try to preserve the heel pad so that it can allow weight bearing on the residual limb. Like if they cut you like this, right? Yes. After this place heals up, you can stand on it. You can bear weight. Yeah. You understand? So instead of cutting the leg here, they just try to cut and preserve the leg to the best of their ability, you know. So you're trying to preserve it, you know. So it was named after James Syme. He's a Scottish surgeon who first described this procedure in the 19th century. So when will you need to do a Syme amputation? When there's severe trauma, like crush injuries. So the injuries were actually to the foot. So you just try to cut it and preserve much of the leg as possible. If there's an infection like gangrenes or osteomyelitis, okay? There's tumors, so cancers to the foot. Then vascular disease too. Ischemia, all those diabetic, you know, complications. Diabetic foot, athlete's foot, all those infections, you know. So I think that's what we got. So the surgical procedure is just simple. You can see how, can you see how it to be cut like this, then like this, you know. So the foot is removed at the ankle. The heel pad is preserved and repositioned under the tibia and the fibula, so you can create a durable and also weight-bearing surface. So at least the person will really feel like their leg is so out. Do you understand? So the residual limb can be reshaped, and they can also give a prosthetic. Okay, they can give you something that you can put. Then instead of bearing weight directly with the leg, you can be bearing weight using this thing that is covering the leg. You understand? So rehabilitation prosthetics. So Syme's prosthetics allows weight bearing through the heel pad. So modern designs are lightweight and cosmetically acceptable. So physical therapy. So we focus on gait training and strengthening. So occupational therapy helps patients to now adapt to daily activities. Then also psychological support is very important, okay, for adjustment to limb loss. Okay, try to talk the person through the situation.